Foot problems can affect anyone who has diabetes, whether they're being treated with insulin, tablets, non-insulin injections, or diet and physical activity alone. People with diabetes are at increased risk of peripheral vascular disease and neuropathy, as well as having a higher risk of developing infections and decreased ability to clear infections. Therefore, people with diabetes are prone to frequent and often severe foot problems, and a relatively high risk of infection, gangrene and amputation. It's important to understand how foot problems develop and how they can be prevented or detected early so that they can be treated successfully. In this programme, we look at the latest innovations in diabetic foot care and hear the views of family GP and television personality Dr. Chris Steele, Dr. Hugh Simpson from the Centre for Diabetes at the Royal Berkshire NHS Foundation Trust, John Grumitt, Vice President of the International Diabetes Federation, Professor Michael Edmonds, Podiatry Consultant at King's College Hospital, and Helen Hanley and Kathy Bendel from Shanico explain why the right footwear is important for people with diabetes.
Patients with diabetes have to look after their feet, because you could have complications from the diabetes in that you might have impaired circulation, so the blood isn't flowing there as freely as possible. You might have damage to the nerves going to your feet, a condition called peripheral neuropathy, so your sensation may not be the same. And so in that setting, if you break the skin or any damage occurs to your foot, it could be minor, skin can be broken, bacteria on the skin might thrive in that area because there's high levels of sugar from your diabetes. Bacteria love sugar, so infections can be rampant, and not just infections but the impaired circulation. You could be facing impaired circulation so severe that you might be facing gangrene, and the consequences of gangrene or possible amputation.
What is diabetic neuropathy? Neuropathy in simple terms is when the nerves, usually to the feet and lower extremities, are damaged by the diabetic condition, namely the raised blood glucose. There are various forms neuropathy can take. The commonest is a loss of sensation, which takes the form of a glove and stocking loss of sensation, affecting usually the feet and then coming up the legs in some cases. The neuropathy can also occasionally be painful. They can get tingling, burning, and a feeling of pressure, as if they've got shoes which are too tight when they have not. And that can be quite distressing and occurs particularly at night and can keep them awake. And there is specific medication which can help that. Also, the neuropathy can affect the motor nerves as well as the sensation nerves I've been alluding to, so that certain muscle groups can become wasted and weak, particularly the thigh muscles, and sometimes the muscles to the eyes, so that you get double vision because one eye isn't moving as well as the other. And finally, it can affect the nerves we don't even think about, like the nerves which control sweating and keep your blood pressure up when you stand up quickly, so that they can suffer from fainting episodes and excessive sweating.
For feet, Diabetes UK, together with NHS Diabetes at the Department of Health, have been pushing a big campaign for healthcare professionals to be aware of the risks to do with feet and the actions that they could take to ensure that those 80% of foot amputations are avoided. And those are available on the Department of Health NHS Diabetes website and Diabetes UK's website. They're widely out there, and the specialists in the hospital as well as the commissioners should know about that and should be pushing those messages right the way out throughout the system.
As a long-serving member of the UK pharmaceutical industry, I'm really passionate about promoting products that help people with diabetes and make a real difference to their lives. Daily, when I attend clinics in diabetes centres, for GP practices, hospitals and other community clinics, I witness the debilitating effect that diabetes can have on sufferers. I feel really privileged when I'm talking to healthcare professionals and see the results they have achieved through using our therapeutic range of skincare products. Our focus is on delivering effective value-added solutions to families and patients, and we have a real determination to understand their condition. We do this through the Flexital brand.
Diabetic foot disease has become a major problem in the UK, and we have now the situation of 80 major amputations per week in our diabetic patients. Why is this? Diabetes leads to high blood sugar. The high sugar damages the nerves, leading to neuropathy, and also damages the arteries, leading to accelerated atherosclerosis and blockage of the arteries, and therefore reduction of blood supply. In our diabetic population, 50% of the patients will have some degree of nerve damage or neuropathy, and 25% will have both neuropathy and reduction in blood supply. So these factors lead to problems with our patients in their feet. The neuropathy leads to numb feet. The patients cannot feel any trauma which might befall them. On top of that, the neuropathy leads to a dry skin. The sweat glands do not work properly, and this leads to lack of sweating and a dry skin, which is very susceptible to fissures and cracks. These, untreated, can lead to ulcers. Ulcers lead to infection, and infection leads to gangrene. And this pathway is responsible for many of the major amputations in our diabetic patients today. 80% of these major amputations are preventable by good diabetic foot care.
Well, very commonly in our patients with diabetes, we come across a lot of patients who've got very dry skin. Some of the skin's mildly dry, some of it has deep, dark fissures, which is very important to get on top of with regard to the patients, because as Professor Edmonds says, they can become ulcerated. So using ordinary emollients isn't sufficient enough for these types of patients. Ones with urea are much better, and they're very well tolerated as far as the patients are concerned. And importantly, when patients are applying these creams, it can also encourage them to monitor their feet very closely and look for other problems and highlight that to their healthcare professionals also.
Well, our main product is Flexital Heel Balm, which is a highly effective moisturiser for very dry cracked heels. It contains 25% urea in a highly concentrated emollient base. Flexital Heel Balm is a clinically proven treatment for very dry cracked feet, and it's a market leader in the UK as well as many other countries. The patient would normally apply it once or twice a day, and twice a day is the most effective way of actually applying it, and what it would mean is that the patient would actually be remedied from the very dry cracked heels, which they normally associate with diabetic anhidrosis, which is very dry skin. Flexital promotes a healthier, visibly looking skin within 3 days of application. And also it's what's known as a Class 2A medical device, which means that it's been through stringent quality testing and it's a quality assured product. Also we have Flexital Skin Balm, which is a 12.5% urea containing product, which is for eczema and psoriasis and also for very dry skin conditions. Flexital Skin Balm is also recommended as a maintenance treatment for the heel after the patient has used the heel balm to keep the heel supple. We also promote a range of therapeutic and convenient products that can be used by diabetic patients. Products such as easy-to-use Heel Magic, light and non-messy gel moisturising socks, vitamin E enriched daily moisturising foot cream, Spray on Bliss Stop, a blister prevention spray, and callus cream, which is used to soften the hard skin on the feet.
Dear Sir or Madam, I am writing to you as I have been using your Flexital Heel Balm, and I'm so amazed at the way the cracks on my feet have healed. I have been using this for 3 weeks now. As my mum lost both of her legs to diabetes, I have to make sure I look after my feet. I will have to continue using these products forever but I'm so pleased with the results and do not want to suffer like my poor mum did. So thought I needed to thank you once again for what I think is a wonderful product.
Thanks for a product which has greatly improved the condition of my diabetic feet over many years now. Flexitol has made a huge difference to my feet and was in fact recommended to me by our NHS podiatrist. Last year I walked 650 miles and I am on course to my target of 1,000 miles plus this year. Remarkable when you know that for many years I've been unable to walk even half a mile before the pain forced me to stop. Bless you for your care of diabetics like me.
Diabetes can damage nerves, muscles, sweat glands, and circulation in the legs and feet, and can lead to amputations. The rate of amputations in people with diabetes is higher than those without diabetes. This comes at an immeasurable, devastating effect to the patients and their families. It also comes at a huge financial cost to the NHS. Reviewing the feet of people with diabetes on a regular basis can significantly reduce and possibly even prevent the complications which arise. Flexitol continues to develop a loyal following within the diabetic community. The success of the products are testimony to the quality and efficacy behind the brand. The brand has a growing trust factor with patients, pharmacies, and healthcare professionals alike. We are extremely proud that today Flexitol is recognised by doctors, nurses, pharmacists, and podiatrists for its clinically proven efficacy. And indeed, it is the first choice treatment option in anhidrosis associated with diabetes.
If you have diabetes, you've got to take care of your feet. Now, this may mean that you should be attending your diabetic nurse at your practice on a regular basis. You might be attending your diabetic clinic at the local hospital. And these healthcare professionals will be asking you about your feet. If there are problems, there are all sorts of things that can be done, special footwear, special advice from physiotherapists, from podiatrists, from chiropodists, and these are the professionals who will help you take care of your feet as you suffer diabetes through your life, because your diabetes will not go away.
Diabetic foot ulceration is the commonest cause for amputation of the lower limbs, other than patients who have had trauma from road traffic accidents, etc. Something in the region of 60 to 70% of all non-traumatic amputations are due to diabetic ulceration, due to either neuropathy or shortage of blood supply. So it is absolutely crucial that every effort is made by the person with diabetes themselves and by their doctors and podiatrists to prevent this happening. And in the majority of cases, good foot care can prevent the need for amputation.
Chanico are a family-run business that's been in the orthopaedic footwear industry for over 40 years now. It was started in 1971 by Chris and Angela Hanley, and today is run by their daughter Helen together with her sister Victoria from our factory in Northampton. Chanico range of shoes has been developed over 34 years and is now one of the largest ranges in the country of stock, modular and bespoke orthopaedic shoes. They come in a range of adult and paediatric sizes, and there are also some specialist diabetic styles, although any styles in the range can be made to a diabetic specification if required. We also manufacture our own custom orthotics from the factory in Northampton. This can include anything from AFOs, DAFOs, insoles, etc., either independently or together with patients' footwear to ensure an exact fit. And we also have stock here of stock orthotics that have been imported from manufacturers from around the world. One of the benefits of our modular footwear means that any existing deformities or problem areas can be accommodated within the shape of the shoe. We use CAD/CAM technology to ensure the accuracy of all our footwear, and this also has the benefit of each patient's individual prescription being stored electronically, so should they require another pair in the future, producing a repeat pair from our point of view is extremely straightforward.
We also use a similar type of technology in the production of our total contact insoles, which are special insoles that aim to provide maximum contact with the sole of the foot at all times, which is commonly believed to help prevent ulceration. And once again, if there are existing deformities already or problem areas, we can alter the shape of the TCI to either give more freedom of movement in that area or just to give space to heal. Chanico footwear can also be manufactured to accommodate AFOs and other types of orthosis that are commonly required by people with diabetic foot problems. We can make those here as a custom orthotic or provide them as a stock item, and they can be provided independently or more commonly together with the footwear to ensure an exact fit.
The process of making Chanico footwear begins with the patient's measurements. These are received in many different ways, but predominantly handwritten or in the form of a draft or cast, along with an impression box for TCIs. We are hoping that in the near future we'll be promoting 3D full foot scanners and receiving measurements electronically, which will allow greater accuracy and repeatability. Although plantar foot scanners have been routinely used for insole manufacture for a while, full foot scanners are not so common and require much larger space in the clinic. Once we have the patient's measurements and the prescription from the orthotist, we choose the closest last to the shape and size as a base for the shoes. We then vacuum form a plastic shape over the lasts and then use cork to build up either as described by the orthotist or to achieve the shape or measurements given. Typically, we might add a bunion or extra depth over specific toes, increase the circumference around the instep to allow for swelling, or even increase the volume all around the back section of the last to allow for an AFO, or any combination of these. If the feet are particularly unusual in shape and a cast is supplied, we will fill and strip the cast and use that to create the last, which will achieve a much closer fit. The last is transferred to the Shoemaster system, where we select an existing pattern from our library of previously digitised styles and amend the detail to match the new last. Most patients have chosen a style from our catalogue and therefore we already have the pattern, but it's also possible for us to create a totally new style from a picture in the same way. The amended patterns are stored and transferred to the cutting tables, where the various materials are laid out and then the individual pieces positioned to avoid any flaws in the leather and to ensure that the materials stretch in the correct plane. Specific edges are skived to allow for neat seams, and other edges are beaded either by hand or machine depending on style, and a backing material added to the vamp of softy leathers to help the upper retain its shape during the lasting process. Flat machines are used to sew together all the different components, and once the lining and outside sections are complete, they are joined together using a post machine. Padding is added to the collar area and the whole upper is fitted together. The almost complete upper is then under trimmed to finish off the facings and to remove any excess lining. If required, eyelets, ski hooks or D-rings are added and the upper is toe puffed ready for lasting. The toe puff gives the shape to the toe area of the shoe, and in diabetic footwear we use a rim toe puff to minimise pressure over the top of the toes. Stiffeners are then added and the uppers are heated and frozen in the heel area and moulded to give a firm shape. An insole board is added to the bottom of the built-up last. This is either to the standard bottom shape or hand cut to fit the shape of the amended last and therefore the foot. For diabetic footwear, we use a firmer board to reduce the flexibility of the sole and hence the shear forces on the foot. The toe area of the upper is steamed and then placed over the last and the toe shape created in the toe laster. The sides are pulled in and the seat area is lifted, glued and refolded. The upper is now fully lasted. The lasted uppers travel through the heat setter to ensure a tight fit and to steam out any creases. The bottom of the upper is roughed and prepared for soling. The sole units have been cut previously, again either to the standard bottom shape of the last or hand cut to fit the altered shape as necessary. The sole and the underside of the lasted upper are glued before being joined together and secured in a press to create the final shoe. Whilst the shoe is being manufactured, insoles are also being made. The impression box of the patient's feet or the scan received is corrected as per the prescription and then the insoles milled. Met bars, met domes, cutouts and sinks can all be incorporated to aid the diabetic foot in alleviating pressure in susceptible or healing areas. Once the insoles are milled, they are finished and covered, often with a pressure relieving material, and placed inside the shoe ready for dispatch. All our footwear is dispatched within 10 days from receipt of order. Many of our shoes are dispatched at trial fitting stage before the soles have been added for patients to try on to ensure the correct fit of the insoles and footwear. At this stage we are able to make small amendments to the last and to relast the uppers. Footwear is often adapted to help with mobility or stability. T-straps, stirrup straps and sockets can be added for calipers, and raises, rocker soles, floats and elongations for stability and to aid a more natural gait pattern. Ultimately, many processes and the skills of our highly experienced staff are combined to create fully tailored to the patient footwear, which will hopefully improve mobility, foot health and longer-term quality of life.
I've just received my shoes from you and want to thank you so much. I've been such a pain to you with all the alterations. They are beautifully made and I know they will alter my life. Thank you once again.
I take this opportunity to thank you personally and the ladies that you work with for all their help and kindness. You and your company have made my life much easier to cope with. The help and the professional manner in which you deal with me and no doubt all of your customers is a breath of fresh air.
Please accept my thanks for the quick delivery of my sandals and most of all the comfort they give me. Also, my shoes are fine and make walking a pleasure after 50 years. Thank you again.
Because of diabetes, I've been wearing your Chanico shoes. May I say, what a superb product. They are light, comfortable and great for long periods of wear, particularly in the daytime.
Many thanks for the excellent service and patience. Your diligence in providing a good service resulted in perfect fit first time, which meant freedom for my 8-year-old mother. Without your service, my mother would have been housebound. She is arthritic but mobile. Being housebound would have resulted in a loss of confidence and social life. My mum was dancing when she got the shoes. It's the best Christmas present ever.
Our footwear plays a key part in the treatment of diabetic foot problems because we custom make each pair to the individual's specific prescription. Innovations in technology are happening all the time, but we can't just rely on technology. We would encourage anyone involved in prescribing orthopaedic footwear to come and talk to us. We're always interested in extending our product range and hearing their views. Our customer base extends from the largest NHS trusts to private healthcare companies down to individual customers, and we aim to provide the same great service and product to all. When we receive letters from customers who've just received their Chanico shoes and they can walk pain-free for the first time in several years, it's just wonderful.
There are guidelines out there, there are checklists out there for patients, for people with diabetes, so they know what care they should be receiving. Now, for clinicians, there are the NICE standards and the care processes, but for patients, Diabetes UK, together with healthcare professionals, have produced a list of healthcare essentials, and if people took those and know what care they should be getting, that really helps, because that means you've got a patient who knows these are the things I should be asking for. And I would certainly encourage them to do that. You can find those on the Diabetes UK website, and if you just tap in 15 healthcare essentials, you'll find them there.
As you have seen, people with diabetes are more vulnerable to foot problems because diabetes can damage nerves and reduce blood flow to the feet. It's estimated that 1 in 5 people with diabetes who seek hospital care do so for foot problems. By taking proper care of your feet, most serious health problems associated with diabetes can be prevented. I'm Georgina Burnett, and you've been watching Feet First in the NHS.